All right. All right, so we'll get started. My name is Daisy Ortega. I serve as the Director of the Community Health Training Institute. Today's webinar is provided to you for free in result of very generous funds through the Massachusetts Department of Public Health. And we're excited to present to you an overview of the Community Health Improvement Planning process. This webinar today, which is the first part, and there will be 2 follow-up trainings that are repeated that we'll mention a little later too to continue this conversation and this learning. But before we jump into the content and I pass it over to my presenters, I just want to do a little housekeeping here. So on your screen, you'll see there that you are more than welcome to join our email list so you can stay updated to latest trainings and webinars and other good information. You can just text training inst, or you see the text there, to 22828, and it will automatically sign you up into constant contact. We also encourage you to engage with us via Twitter, and our hashtag is hashtag MA Coalition. So we welcome any questions or comments throughout the presentation after at any point if you want to use that vehicle. So just to, progress too fast, but here, just if you haven't been involved with a webinar before, just to review some housekeeping here. So there will be a questions box on the right side of your screen. We will be asking you some questions and we ask you to type it into that box. And we will address your questions as we go along and also through specific sections of the webinar. So please be alert with that. And also at the end of the webinar, we will have a quick survey pop up for you so you can give us some feedback on how this webinar happened, and we'd love that feedback from you all. And then a few days after the webinar, you'll receive a link including the slides, additional resources, and also the recording of today's webinar. Again, the hashtag is there so you can tweet questions or comments, and please don't forget to tag us at HRA Institute during or after the webinar. And again, here goes the question box in case you're not familiar with it. You type it into there and send it, and don't worry, we will get to your questions and comments throughout the presentation. And just FYI, we have some really great trainings and webinars coming up. And like I mentioned, this is the webinar is the first part of a 2-part series. We have 2 follow-up trainings, so they're repeated. So Boston and Central Massachusetts will be the same content, but it's offered 2 different dates in 2 different locations to make it more convenient for you. This is an optional follow-up to today's webinar, so we encourage you to consider going there and really joining us to continue this conversation, looking a little more into implementing a community health improvement plan in your community. We also are prefacing a health equity series that we are starting in January. So Introduction to Equity and Community Building. And there's also 2 other parts to that that we will mention a little later as well. But you're always welcome to look at hrainstitute.org for more information on our trainings and webinars and other really cool and amazing work happening in communities. All right, so I will pass it off to my wonderful presenters now, and we hope you have a great webinar.
Great. Thank you, Daisy. Good afternoon, folks. This is Steve Verdini. I'm Vice President of Programs here at Health Resources in Action, and it's a pleasure to talk to you today about community health improvement planning processes. I'd like to introduce my colleague and friend, Amanda Ayers.
Hi, this is Amanda Ayers, and I am with the Strategic Planning and Organizational Effectiveness Division here at Health Resources in Action, and we're really excited to present this content to you today. And I just want to reiterate that we welcome your questions throughout the webinar and be happy to address any specifics that you might have as it pertains to the CHIP.
Yes, and I want to emphasize what Amanda's saying. Please feel free to ask us questions as we're doing our presentation, because either Maya or Daisy will get us those questions, and we're happy to answer those. As you can imagine, in this kind of format, it's sometimes challenging to have a discussion, but we're happy to entertain questions throughout our presentation. So as we go through today's presentation, what we wanted to share, there are 2 main objectives. One is we wanted to describe a broad overview of the CHIP process, the Community Health Improvement Planning process, and the resources required to complete this effectively. We also wanted to share with you, as we go through what we feel like are the steps of this process, some tools and strategies to not only engage authentic community, have an authentic community engagement process, but also have a process that yields a plan that is data-driven with metrics. And so our hope is today is to be able to share with you what our experience has been conducting almost 60 of these health improvement planning processes around the country over the last few years, and some of our work at the national level with the Centers for Disease Control and Prevention as we've helped them develop the Community Health Improvement Navigator. So again, our hope is to share with you some of our learnings, both from the research and from the practice, and hopefully to hear from you, because as we looked at some of the folks that are participating today, it looks like we've got quite a few folks that are engaged in CHIP planning processes, and we'd love to hear from you. So as we go to the next slide, our agenda for today is to provide a little bit of an overview of a community health assessment and health improvement plan. We'll do that for about an hour or so, a little over an hour, and then really have some time for Q&A. Again, we also encourage Q&A through the process, and then we'll have a closing and talk about future trainings. So if we go to the first question, we'd love for you to answer this question, these two questions. The first is, have you completed a community health improvement plan? And we'd like you to ask, the answers are, haven't started yet, just beginning to think about it, beginning implementation, and well underway. So again, if you take a minute to answer the question, have you completed a CHIP?
Awesome. So we'll give folks to fill that out. That is on your screen. So if you want to get a chance to just fill that out, just to give us an idea of who's in the audience, that would be great. So we'll give you another minute to fill that out. Awesome. So we're about to close it, so give you a chance to fill that out. But we're going to close the poll now.
Okay, so interesting. So what we're seeing is a little over a third of you are just beginning to think about doing a CHIP, and another third or so are just underneath that, haven't started yet. And then we've got a few folks, about a little 1 in 5, a little bit over that, are well underway in the CHIP planning process. And then some are beginning to think about implementation. So we've got a nice mix of individuals in terms of thinking about those who are well underway, those who are thinking about it, and those who aren't there yet. So it'd be great to hopefully share some of your questions with us and some of your experiences. And we look forward to having this conversation with you today. So before we get into discussing a CHIP, we just wanted to make sure we're all on the same page as we think about this whole idea of community health improvement. And I guess what I want to be careful about is that there's a lot of acronyms and language that people are throwing around, and we want to make sure we're all on the same page. So as we have done more of this work across the country, what we've come to realize is that it's important to think about all of this work under a frame of community health improvement. And so whether people call it CHI or community health improvement, that notion allows us to think about the various stages of this work. And community health improvement includes the first phase around community health assessment, a second phase around community health improvement planning, a third phase around community health improvement planning implementation, and then a final phase around monitoring and evaluation. And then some people might even talk about a phase around sustainability and quality improvement. So as we think about this, all of these phases or steps are embedded under something called community health improvement. And what we want to talk to you a little bit about today is very briefly about assessment, and then what this workshop really is about in terms of community health improvement planning. Okay? So when we think about community health assessments, typically assessments either being done by hospitals or health departments philanthropy or nonprofits or federally qualified health centers at the local level, sometimes also at the state level, provide an opportunity for individuals to gather information on the assets and needs that exist within the area that they're looking at, typically a geography, a municipality, or a region. And that from this data, stakeholders that are engaged in this process can begin to think about prioritizing what the health issues are based on that data, and they can also think about how to best allocate resources to achieve or address some of those issues. And so as we go through today, what we wanted to share with you from the process of thinking about community health assessment is that we look at this as a multi-step process. And so as you're looking at this slide, and I'll just take a minute for people to take a look.
Give us a
Thank you, Daisy and Maya. So as we were talking about in terms of thinking about this idea of a community health assessment, if we go to the next slide, what we want to do is share with you, okay, so in terms of the next slide, this is an overview of kind of conducting an effective community health assessment process that basically has 5 steps. So the first step is to form kind of a leadership team. The second is looking at data collection. The third is analyzing the findings from that data, both the quantitative and qualitative data. The next step or phase is to develop a report. And then the final phase is to disseminate findings through community meetings and through social media and other types of technology. Those steps are all guided by a set of guiding principles that relate to collaboration, transparency and communication, and engagement, all working towards a common vision that either internal and external partners may work towards. So again, that's just a brief overview of how we think about community health assessment processes. And that applies to hospitals, health departments, health centers, or private philanthropy, other folks that are doing assessment work. So in the next slide, okay, I'm just looking to, okay, in the next slide, when we think about what is a community health improvement plan, we have an opportunity to kind of think about this plan in terms of something that could be anywhere from 3 to 5 years in length. It is based on a set of strategic directions with goals, objectives, strategies, and measures or metrics to look at success. And it contains opportunities to leverage resources, develop partnerships, and focus and coordinate efforts. So as we go through this process, what I wanted to share with you in terms of thinking about this also from a visual perspective is a typical community health improvement planning process for us also includes roughly 5 steps or 5 phases. The first is also similar to an assessment process, is forming some type of stakeholder or leadership team. The second is reviewing and prioritizing both the quantitative and qualitative data. The third step is developing and disseminating an implementation plan, and each year annual action plans with metrics. The next step is implementing the plan. That could be both the evidence-based work as well as the innovative work. And then the final piece is monitoring and evaluating and communicating your efforts. Again, this is all guided by a set of guiding principles around authentic engagement, communication, and collaboration. There may be other types of principles that you use in addition to the 3 that we've identified here. We'd be happy to hear what those are. And again, all working towards kind of a common vision that's typically determined by the group that's working on an assessment and health improvement planning process. So you can see we used a similar kind of matrix or model similar to the health and assessment process, but as we think about health improvement planning, it's very much, our experience has been, it's very much kind of a 5-step process. In terms of thinking about why develop a community health improvement plan, we often think about these as responding and serving or addressing community need. We think about CHIPS as coordinating and aligning strategies between organizations and programs. The beauty of a CHIP is that entities, multi-sector partners can come together to share what it is they're doing individually, and then CHIPS allow us to kind of capture what folks are doing individually, but CHIPS also allow us to look at where we can coordinate and align resources and efforts to really address collective impact. CHIPS also allow us to harness collective resources and build political will to achieve what it is we're interested in achieving. It helps us establish a shared framework for community health, and in some cases, such as working with health departments, it fulfills requirements for accreditation. For hospitals, this fulfills requirements around IRS guidelines, and for other entities, this helps fulfill other types of requirements. So what I wanted to share with you is when we think about these efforts, there are a variety of multi-sector planning efforts that potentially could be happening in your community or your region. So with the 2,800 public health departments at the state and local level across the country, there are 2,800 health departments that may be thinking about doing this type of work if they're interested in accreditation. There are 29, almost 3,000 tax-exempt nonprofit hospitals that are required to do this work through IRS guidelines. We have almost 1,000 federally qualified health centers that are doing this work to meet HRSA designation. We have community action agencies through the Community Development Block Grant that have to do some level of assessment and planning. We have CDFIs or community development finance institutions doing this type of work. United Way affiliates, public housing agencies, and area agencies on aging. So as we think about this work, it's important to even go beyond what hospitals or health departments need to think about and to see what other partners in the community potentially are doing community health improvement work and assessment planning, and potentially look at ways to collaborate with these entities. When we look at the work of, in particular with hospitals and health departments, we have an opportunity to think about what hospitals are doing at the local or regional level and what health departments are doing at the local and state level. And in each instance, each of these entities has to do some level of assessment, whether it's a community health needs assessment, a community health assessment, or a state health-wide assessment. Each of these entities has to do some type of health improvement plan, whether that's a statewide health improvement plan, a community health improvement plan, or some type of improvement plan that's related to a strategic implementation plan for hospitals. And then oftentimes what happens is health departments also for accreditation purposes have to do an agency strategic plan. So you can see there's a lot of opportunity for overlap here. There's also a lot of opportunity for alignment and collaboration. When we think about this work, in addition to the hospitals and health departments, and looking at the list that we shared before, there are many other partners that are worth connecting with in the community who are either required to do this work, or many other partners in the community who are doing good work that it's important to connect to. And these could be other health and human service agencies, community-based organizations, and other institutions in the community, so that there's an opportunity to look at aligning efforts around similar goals and improving population health outcomes, minimizing duplication of services, leveraging cross-sector resources, and providing a foundation for sustainability and impact over time. So with this final piece, again, in looking at these steps, I just wanted to review these steps, and then Amanda is going to dive deeper into each one of these steps, sharing a little bit about each of these steps and some tools that are available. And we will talk about this today and also make this PowerPoint presentation available to you, so that if you need to use some of these tools to do your work, please feel free to do so. If you also need some assistance, some technical assistance thinking through the use of these tools, we're happy to answer. So again, as you think about community health improvement planning, if you think about starting with the broad vision and some guiding principles that bring together the multi-sector partners that are doing this work, we typically think about this work in 5 steps in terms of forming a leadership team and some kind of governance structure, reviewing data and prioritizing the data, developing and disseminating an implementation plan and annual action plans with metrics, implementing that plan in terms of evidence-based approaches or innovative approaches, and then monitoring and evaluating and communicating your efforts. So I'd like to now turn it over to Amanda to take us deeply into each of these areas.
Great, thank you, Steve. So let's start with step one, and we're looking at talking about defining and convening our leadership bodies and what their role is. So you'll see this is a nice visual for you to kind of think about what your leadership body might look like and what they're responsible for. So some of you may have advisory boards, you may have steering committees, you may have a different term for it, but what we're looking at is providing several different levels of leadership to get this work done. So you'll see at the top, for an example, we have an advisory board here, and what their role is really to see the oversight of the community health planning process. So whether that's your CHA or your CHIP, they're kind of the overseeing board. They help with the identification of priorities that come out of your CHA data, and they give strategic guidance to the people who are actually doing the work to make this happen. Now, you may or may not have an intermediary leadership level. Here we have an example of a steering committee, which looks at overall management of the process, and they actually participate in the working groups as leads or members of those working groups. And then at the bottom here, we have our CHIP working groups. Those groups are typically aligned with your priority areas. So when you've taken your data from your CHA and you've come up with, as Steve mentioned, 3 to 5 priority areas around a particular health topic, you have a work group for each of those priority areas. We're going to talk about this in more detail, but what we like to see here is those work groups being representative of the diverse sectors that are part of your community. So we want those work groups to have a good cross-collaboration of people that are in your community. And again, they're formed around each health priority area, and in those work groups is where the group works to develop your goals, objectives, strategies, and action steps to actually get your plan implemented. Okay. A lot of people have questions about how to do this outreach to key community stakeholders and what is a key community stakeholder. Here we want to emphasize that you really want to, this is a really key component to not only getting your plan being comprehensive and cohesive, but when you're moving to the implementation phase, it's really important to make sure you've engaged everyone that's going to be key in actually implementing this plan. So the benefits of taking your time and doing this component right, we can't stress enough. So I'm going to show you a few tools, but we're going to talk about multiple ways to engage and collaborate those stakeholders. So here you see one of the tools that we use, and this is our sector and stakeholder engagement wheel. And it'll show you that, sometimes when people are thinking about a health improvement process, they think they really want to involve just health entities. This is actually a tool to show you how all of the other entities that are part of your community are really valuable and can play an important role. All the way from government, and that comes in if you want to make policy changes, or implement specific policies, regulations, Board of Health regulations in your community, all the way to business and industry. That comes in terms of funding, lots of other different, we have professional associations that are often really good collaborators as part of this process. We have education, healthcare, community services, faith-based organizations, your senior service centers, so that you can see here it's a very detailed list, but this is a matrix to kind of get you to think out of the box about who you might want to involve as part of this process. This is our stakeholder and community engagement matrix. So it lets you kind of set a plan for how are you going to engage those people. Now, oftentimes people will say, I don't have the time to dedicate to X number of meetings for a 6-month period of time as you're going through this process. And what we like to tell people and remind people is that there are a lot of different ways people can engage. You might have people that are really engaged in the process, can't be there physically, but they're willing to review documents virtually, provide feedback. They're willing to be conduits for outreach to other people in the community that you'd like to engage. They're willing to, write grants if that's part of your process. There are a lot of different levels of engagement. So this is a way for you to kind of catalog and keep track of who you have that you're reaching out to, what role or sector they represent, and how are they going to be engaged. Are they willing to just offer information? Are they willing to sit on one of your subcommittees? Are they willing to be part of your steering committee? All of those levels you can see across the top, but this is an excellent tool to kind of keep you on track and make sure that you're looking at meeting all of those different sectors to make sure you have really good representation as part of this process. So one of the things that people often go through when they're doing this process is they look at different planning models. So this slide is really meant to be a resource for you to see some examples of a few different models on the left, the source of those models, and a brief description on the right of what those models encompass if you're looking to align your efforts with a specific planning model. So that's what this slide is about, really to be used as a resource for you. So step 2 is looking at your health topic, issue, and prioritization options. So after you do your community health assessment and you come up with the data that represents where you are with the health issues in your community, you want to take all of those issues and kind of rate and rank them for how are you going to choose the 3 to 5 things you want to focus on. Now, one of the important things we want to emphasize here is that all of the health issues that come out of your data assessment are important. All of them are important. However, in order to come up with a plan that is realistic and can be moved and implemented on, we look at recommending that you choose 3 to 5 areas to focus on. Now the question comes, how do you get to those 3 to 5 areas? So we have a suggestion here for some rating and ranking criteria, some questions that we put out there for you to ask in terms of choosing those 3 to 5 are how relevant is the particular health topic, how appropriate is it, and when we say appropriate, it means should you actually move forward with this topic, and that gets to is there political will surrounding that topic, is there funding, are there already agencies or organizations that are working on that topic, that all falls under the category of appropriateness. Impact, what will we get out of focusing on this issue? Is it a high percentage of our community that will benefit from us focusing on this issue? That is how we get at impact. And then feasibility, can we do it? Are there in some cases you have a health topic that might cover 3 of these questions, but not the 4th. So it might be relevant and appropriate, and you might get a lot of impact, but feasibility-wise, you have some roadblocks that you know realistically you can't overcome to make that be a successful initiative. So in looking at this is another one of our tools, our rating and ranking key health issues. And this looks at first kind of we take the column on the left where it says step 1, list key health issues, and you're looking at listing the issues that came out of your community health assessment. Now, typically when we do this with the community, you have a lot more than what's listed here. When we go through this rating and ranking process, we usually are looking at rating and ranking between sometimes up to 30 different health issues. So don't think just because you see a certain number on this tool that you have to maintain this. When the issues come out and you're getting community input and feedback about what's important, you'll probably end up with a lot more than this. However, this is a matrix for you to use as a launching point. So what you do is you put your issues on the left and then you rate them against the selection criteria across the top. So in terms of rating them, you give each issue a 1 to a 4. 1 is being a low priority, 4 is being very high priority across those selection criteria, and you end up with step 3, a total ranking for each particular health topic area. After you've done that, you go to step 4, which is to rank order the key health issues. And doing this process is a really great way to do it. People feel like they are able to have their own individual input, but they are able to see collectively. When you have everyone do this individually, then you tally these results collectively with the group that you're working with, and you're able to see very clearly what 3 to 5 health topics come out on top, and that's how you're able to move forward with those health topics to develop your chip. Okay, so now we're at chip development, step 3. This is the process that we go through after we've chosen prioritized our health issues or topics. We say, what is our vision or our values for this process? And then we develop goals, objectives, and strategies for each specific health topic. So just overall, when you're looking at doing this process, you want to have a vision. So your vision is really a description of the preferred future you're trying to create as a result of your work. It's very broad. You can see we have one example here. All residents of Somerset County have an equal opportunity to pursue healthy lifestyles and achieve social, emotional, physical, and spiritual well-being. That's their vision. That's their preferred future. You can see below we have a couple other examples, and you can elaborate on that. But in general, you like to have a vision for the work that you're engaging in. When we go to look at each of our specific health priorities that are chosen, we want to come up with goals and objectives for each one. So for a goal, that is your projected state of affairs that a person or system plans or intends to achieve. So a goal is intended to be very broad. It's how are things going to change in order to solve the problem that you've identified, and what's the result that you're looking to get at. That, again, is a broad statement as it relates to a particular health topic. Where we get more specific is our objectives. So your objectives are the steps that you're going to take in order to achieve the behavior change that you've described in your goal. So objectives talk about the how much. So objectives are very specific. They're very measurable. You're talking about how much do you want to make this change, by when do you want to do it, and they typically an objective typically starts with an adjective of either increase, decrease, enhance, or improve. And usually we try to get groups and organizations to come up with 2 to 4 action-oriented objectives per priority area. So oftentimes you end up with more than that. Sometimes you end up with less. But we like to provide a guideline of approximately 2 to 4. Outcome indicators and strategies. Now, outcome indicators are actually very important. It's often one of the areas that groups struggle with. They don't like to do this, but it's very important in terms of monitoring. Once we get to the monitoring and evaluation component of the process, it's important to have something to be able to look back at, and that's our outcome indicators. So our outcome indicators describe the baseline and target values for each objective based on data. So data is a very important part of this process. You want to make sure that the areas that you've chosen have data to back them up so that you can say and you can show movement and track that back to making a change in a particular data that's either you already have trend data. It's something that you can monitor and follow and be able to track back to show progress. Our strategies get at the very specific approach that you are going to use to get things done. So this is the how. This tracks back to our objective and looks at how your objective is going to be achieved. It identifies the general direction of the specific action steps, and we do them in sequence. So your strategies are very sequential. What are you going to do first, second, third, and so on to get to how are you going to achieve that objective? Just an example, strategies typically start with we're going to identify a particular component, we're going to advocate, we're going to support, develop, train, educate. Those are typically things that start with your strategies. The best strategies are those that have impact in multiple areas. So we're looking at things that are going to give you the biggest outcome for the least amount of work. Do we have any questions at this point? You can all use your comment box to type in questions. Pause for a minute.
Yeah, a lot of good information has been shared so far. Just want to give folks a chance to let us know if you have any questions, to give you a chance to digest it. So I'll give you a chance to type those in if you have any, but any pressing questions. And we saw that some of you are thinking about starting a CHIP process. Some of you are in the process of it or probably completed it. So we'd love to hear your questions if you have any, and also any kind of lessons learned or best practices for those that have engaged in this process. We'd love to hear that as well. We'll give you a chance to type those in and let the information marinate, and we'll keep going. Awesome. So it looks like we have a question here. Thank you, Kim. Do you have any tools to develop indicators or strategies, online tools, for instance?
That's a great question. I think a few things to think about. One is if you're looking for strategies, what I think Amanda and I would suggest from our experiences is please go to the Centers for Disease Control website and look under Community Health Improvement Navigator. Again, I don't have the website, but if you just Google CDC, Community Health Improvement Navigator, or if you also go to CDC Community Commons or Community Health Needs Assessment, all three of those things will get you to a place where you can begin looking at both indicators and potential evidence-based strategies to do this work. Another really great resource is the University of Wisconsin, and we would suggest going to the County Health Rankings or the Roadmaps to Health. And actually, I think under the Roadmaps to Health, you'll find a whole set of evidence-based and innovative strategies that are related to a variety of the priority areas that are typically identified in these CHAs and CHIPs.
Absolutely. And one thing I want to build upon that Steve just mentioned, which is really important, and that is to make sure that the strategies that you're researching are evidence-based. That's one thing that we typically do when we're working with an organization is we'll pull specifically evidence-based strategies for them to look at. This is really important not only for you to get great outcomes with your chip, but if you're looking at building upon existing or getting new funding, funding is almost always directly tied to strategies. They want to make sure that your strategies that you're using are evidence-based. So that's a really important component.
I was going to say that's really important, Amanda. Another place to think about, and I don't know who this person is in terms of whether you're, oh, I see who it is. So Kim, having worked with you in the past, a great place to also go is to the local hospitals to see what types of indicators they've developed with their community health improvement plan. And another really great resource for all of us to be thinking about is our Mass Department of Public Health, and to go to the website to look at what they've created with their state health improvement plan, because they have a series of priorities they've identified through their assessment process and have a series of priorities and indicators and strategies they've identified for their state health improvement plan. So those multiple areas at the national level, you've got the Centers for Disease Control and Prevention sites. You've got the University of Wisconsin Roadmaps to Health. At the local level or at the state level, you've got the Mass Department of Public Health, and you've got local hospitals. Or also local community health centers or federally qualified health centers could be great resources. If you need or are looking for some other resources, please feel free to email Amanda and I after this session. We're happy. But we think any of those four places could give you quite a bit of information. Thanks so much.
And thank you so much. And actually at this juncture of the process, which we're at indicators and strategies, from your experience, are there any typical barriers or challenges that come up at this point, and and what you recommend for folks to think about or think through, especially if they're thinking about starting this process, what things to look out for and be aware of?
Yeah, Amanda, do you want to? Yeah, I mean, I think there are a few things to think about. So when you go back to that diagram of the wheel, maybe let me just go back for a second, if I can.
Click back to that.
If you just go back a few more. Sorry to do this, but I'm very much a visual learner. Just a little bit more. So I think what Amanda and I have found, as well as other members of her team, in each of these steps, there are issues and challenges. So when we're thinking about step one in terms of forming a leadership team, one is you really have to think about going back to the wheel that Amanda created. How do you get a team, a leadership team that is truly reflective of the providers and the community voice in your community? And how do you create a space that allows an opportunity for everyone to be fully engaged and participating in this process? I think when it comes to reviewing and prioritizing data, it's also important to make sure that you have some of the very priority populations you're interested in working with that are engaged in these conversations. Because as you can imagine, depending upon who's in the room at that time or who the decision makers are, that's oftentimes what gets elevated up in terms of the priorities. And so our real learnings over the years has been to make sure that you really do have a diverse representative body of providers, consumers, community members, concerned citizens that are engaged in the process, because all of those voices will really help us look at kind of what the reality is, both from a quantitative side in terms of the data, but also from a contextual side in terms of the qualitative side.
Yep. Another challenge that I think I reiterated when we were talking about the rating and ranking, but I just want to take this opportunity to go back and emphasize that again, is that oftentimes you'll have people in your group that they're really passionate about where the area in which they work. So whether they work in obesity prevention, or they work with cardiac heart health, or they work with domestic violence, they're very passionate about their particular area, and they would like to see their area chosen as one of the 3 to 5 areas that the CHIP focuses on. And it's a good thing that people are passionate about their work, but I think unless you go through a very comprehensive rating and ranking process where you have people collectively thinking about each particular health issue across these selection criteria and really thinking deeply about the resources available in your community, some of the challenges available in your community as it relates to that particular health issue, then you end up with people that are disappointed and potentially disengaged from your process. Whereas even if people are very passionate about their particular health topic, if you go through this process, they can see how it plays out. And so even if their particular issue isn't chosen, doesn't end up as one of those step 4 top ranked issues, they are able to have been able to be part of the process, and they feel like, okay, I said what I need to say. I feel like we've done due diligence to the process, and I feel good, and I'm still excited and engaged about where we've landed with those priority areas. So I just want to emphasize that as one of the key components to actually, it's in the beginning of this process, but this is where you don't want to lose people. So this is where people can kind of fall off the grid and disengage from the process if they feel like they haven't been heard. But when you use a specific tool and you engage people in a way to have them critically and strategically thinking about the health issues, then you're able to kind of win them over, regardless of whether their particular priority area ends up as one of your top 3 to 5.
I really want to emphasize what Amanda's saying here, because this process, what we've learned with this tool, which we began implementing in our process or through our learnings, is it moves things from being subjective to a little bit more objective. And because people are passionate about particular areas, this allows everyone to be heard. It allows for conversations. It doesn't mean that everyone's happy in the end, but there's a greater level of consensus and kind of collaboration after going through this type of process. So it moves the process to a little bit away from subjectivity to a little bit more of objectivity. 2 other things we learned through this process is that as we're developing these community health improvement plans, what we encourage communities to do is not to create a plan that operates in a silo or that is simultaneous to other things, so that as you think about particular areas, and oftentimes we find areas around healthy eating, active living emerging as a priority, or obesity. We find mental health and wellness, substance abuse, healthy sexuality. Those tend to be some of the issues that we're dealing with. What we encourage folks to do is tap into those folks in the community that are working on those issues and find out what is written in their action plans and what is their work. Because there's a real danger in creating a plan that is a simultaneous plan that doesn't integrate or doesn't align with things that are currently happening in the community. In our best case scenarios, we've worked with communities where we've identified 4 or 5, in some cases 6 priorities. We then went out and engaged those task forces or those coalitions operating in those cities or those communities working on those particular areas, so we could see what types of strategies they were implementing, where they had success, where they were having challenges or barriers, who was engaged. And what we ended up creating was a CHIP, or a health improvement plan, that included a lot of the good work that was already happening in the community. And it really didn't duplicate efforts, but was a place to align efforts.
Right. This is all about leveraging resources, and especially in a time where everyone is looking at a decrease in resources, whether that's funding or otherwise. This is your opportunity to really leverage what's already existing in the community to make, collaborate on your efforts and get a larger outcome as a result of that collaboration. So absolutely.
And our feeling is the more you engage folks, whether it's up front with the leadership team or helping them think through the priority rankings or helping them think about developing evidence-based or innovative approaches, the greater level of input that you have, the greater likelihood that there's buy-in and ownership of the plan. And what we've also found through this process is one other potential barrier is that how do you take a plan that you spent a lot of time working on and people feel really excited about, but get the broader community to buy in. And so as we think about this work, we've worked with some effective leaders and communities in terms of thinking about how to disseminate these findings using social media in terms of Facebook, developing videos that could be posted on YouTube, having community meetings that in some cases had the mayor and over 300, 400 people engaged in rolling out what the plan is. So I think there are a variety of ways to use traditional approaches and social media approaches to actively engage and promote the good work of the group that has developed a CHIP process. The last thing you want to see is something sitting on a shelf after all this good work has happened, or that it sits with just a few people. So there are multiple ways to think about engaging folks. And what we have typically found is for the people that are involved, either as a leadership team or they've been involved in this process, we look at them as champions to promote this work and to promote the work of the assessment and the health improvement plan.
Absolutely.
Wonderful. Thank you.
Excellent. All right. We're going to skip ahead to what Steve was just referencing, and that is the developing and dissemination of your final CHIP. So again, we emphasize the importance of engaging content experts, epidemiologists, if you have that resource available to you. Epidemiologists can be very helpful when it comes to making sure you have the most relevant, accurate data that's available in your community, whether that's part of your local or state data. They could be really beneficial as part of this process if you have that resource. But if not, definitely engaging the content experts, and that's people that are working in the specific content areas in your community, whether that's an organization, a community, a coalition, grassroots coalition is excellent to be able to engage those people. And make sure that you have them engaged and they're part of your dissemination so that people in the community will see, okay, the people who are working on this are really excited about this, they're invested in this. You develop your draft CHIP and then you disseminate it widely. And again, that's really important in terms of making sure that it's an active living document and not something that's just something that you've checked off and sits on a shelf.
And what I want to say there, Amanda, another thought about that is in one community where we worked, they had a community health improvement plan that was probably like 30 pages. And what they decided to do is create an executive summary that was 2 pages. And the executive summary had illustrations, so it almost looked like an infographic with the series of things around their priorities. And so what they found is for folks who wanted the full report, they could have that, but for the broader community members and community consumption, it was like a 2-page executive summary with a lot of visuals that really brought home the points that were found in the larger document. So that was another learning that we had, is to think about who your audience is and what you want to share with them, because most people aren't going to sift through a larger document.
Absolutely, absolutely. Those quick drafts, whether it's a 2-page document, a pamphlet, a bulletin, a postcard, have been very effective in some of the communities that we've worked with. So once you've completed your CHIP and you feel like that's a lot of work and we should be done, it's time to gear up and talk about action planning, because your CHIP is actually all of the data and what you want to do, but your action planning is actually getting that done. So the first, we recommend that you kind of transition pretty smoothly and without a lot of lag time between completing your CHIP and getting into the action planning process for several reasons. You want to maintain the momentum that you've built up with your CHIP process. You want to keep those people engaged, and you want to say, okay, all this work that we've done, now we want to actually get to work and start seeing some positive behavior change, positive health improvement change in our community. So the first thing that you do is you take all of those objectives that you have as part of your CHIP and you say, what are we best situated for to action plan and complete for year one? You're not action planning for your whole CHIP document. You action plan 1 year at a time, and that's really important because people feel like, again, this is a heavy lift, it's a lot of information, it's a lot to do, and it can be, but when you do it 1 year at a time and you bite it off in small pieces, you're looking for easy, bigger bang for your buck wins for year one. So as part of developing your action plan for year one, this is a template, an example of a template that we use. So you'll see you have your goal for your priority area at the top, your objective, you have your outcome indicators, and I just want to say that a lot of this information is already in your CHIP, so you're not regenerating a lot of this information. What you are generating is you're getting down to the very nitty-gritty of who are the specific partners that we are going to have help us actually implement these specific strategies. What are the action steps we're going to do for these specific strategies? So you see at the bottom, we have strategy 111 as an example. You're going to come up with 1, 2, 3, anywhere up to 5 maybe action steps for how are you going to complete that strategy. Then you're going to identify who's going to be responsible for that. You're going to say we might have a lead, we might have a manager, we might have someone who's going to implement. Those could be all different people as part of completing that action step. You're going to say what your outcome or your product is going to be, and then you're going to identify a timeline. And we have here an example timeline of breaking things down by quarter. So for your year one, what are you going to do in quarter 1, quarter 2, quarter 3, quarter 4? This is really important because it keeps you tied to a timeline, and it enables you to see the flow of what you need to do happen step by step to get that strategy completed. So this is an example of a tool that we use pretty widely with our action planning, and again, we choose objectives only for year one and only action plan for year one objectives. And our last step here is to monitor, evaluate, and communicate. This is really important for a lot of reasons. One, because when you monitor and evaluate your process, you're able to find out if it's working. And sometimes the biggest thing we say about our CHIP process is that it's a living document. It's a working document. So you've all heard the saying, best laid plans, right? So you might have something in your CHIP that, for whatever reason, doesn't come to fruition, and that's okay. But you'll know that as you're monitoring and evaluating the process that you're going through, if you come up against roadblocks that enable you for whatever reason or don't enable you to move forward with a particular action step or a particular strategy, you'll know that as part of this ongoing monitoring and evaluation process. And the communication comes in where, you've done this big launch for your CHIP, you've let your community know what's happening, people know what's going on. In order to keep them engaged and saying, hey, I wonder what's going on with that, you need to make sure that you're on a regular basis getting some information out there. And organizations do this in different ways. Sometimes they do it on a quarterly basis. Sometimes they do that biannually or even annually. But the point is to make sure that you're saying, this is where we are, this is what we're doing, here are some of our wins, some of our accomplishments for this year. Here are some statistics that we've been able to increase or decrease wherever you're looking to move things, so that you can keep people engaged and let people know that this is an ongoing process and you're showing some success. And you always want to promote your successes.
Exactly. Amanda, I wonder if we go to the next slide, and as opposed to maybe using the polling piece, why don't we ask this question in terms of, so folks who've been listening have had a chance to hear what we're saying and the information we're sharing. And so let us ask you a question in terms of, what's your primary concern or challenge regarding CHIP development?
So in the questions box, you could feel free to type in, and we have some suggested categories there of commitment and accountability of partners, clarity around decision making, managing financial resources, leadership roles, infrastructure, anything. of the above, all of the above, and we'd love to hear some specific nuances to these too in terms of some concerns and challenges you have. So feel free to take a minute or so to think about that and type it in, and we'd love to have that for discussion.
And this could be for folks either are engaged in implementation or folks who are thinking about it in terms of what concerns you think or barriers might you encounter.
Wonderful. Jeannie, thank you so much so far we have questions and thoughts coming in. Beautiful. So as the first one, having the time, finding or funding the expertise to conduct it. Then we also have, so I'll read them out loud and then we can figure out how to parcel these out. Clarity around decision making, being transparent to the overall community. Then there's also commitment and accountability of members, especially when our funding is tied closely to federal funds. And then also whether or not we are pulling in all the relevant questions. These are really great questions so far.
These are great. So should we start with the top one?
Yeah, let's start with the time and the funding, because that's always an issue.
Yes.
And what we have several different ways that we've engaged groups in this process. One of the things that we advise all of our clients on is to always be very respectful of your partner's time, right? People want to make sure that when you are engaging them, whether it's a virtual meeting or an in-person meeting, that time is very constructive, it's very productive, and it's time limited. So if you say it's going to be a 2-hour meeting, you're keeping to that 2 hours. But that being said, this process definitely does take some time. So that's something that you want to be upfront with people. But this also gets back to one of our earlier points about there are different ways for people to engage. So you might want to have some partners who say, I can't dedicate, one meeting a month for 4 months to do this. You don't want to discount that person. You want to say, we would love to have your participation in whatever way you're able to participate. If you're not able to make a meeting, we'd love to engage you virtually. Are you open to being able to review some documents and provide feedback in that way? So that's one thing about the time. In terms of money, funding is always an issue, particularly for this process. And there are different ways that we've seen groups and organizations approach this. People have gotten grant funding to do this process. They've gotten funding from partners. A lot of times where you have a situation where a lot of people can benefit from this data, this analysis and assessment, those groups or entities have gotten together to pool their funding to do this process. Now that could be in Massachusetts, we have community health network areas. So we have CHNAs that have funding, and sometimes CHNAs will partner with their local hospitals. They'll partner with local organizations, larger organizations that tend to have some funding. It might be a YMCA or a health center, community-based health center. So there are lots of different ways to kind of think out of the box. Another option is sometimes we do training where we will train. We call it training of trainers, but we could train a group of people on how to do this process so that people are implementing it and going through this process on their own without having the facilitation from an organization like ours.
Yeah, and if I can build on that, Amanda, that slide that we showed that looked at all the different folks engaged in these planning initiatives, that's a great place to start. So if you're not one of those entities, think about the hospital or the United Way or the Community Development Finance institution or the public health department that's in your area, or a community foundation, some entity that has to do this type of work, and find out what they're doing, because they need to do this either for a mandate or a requirement or federal funding. And so that's a great place to start. And so Amanda listed quite a few of those entities out, but that's a wonderful place to start in terms of funding. And then in terms of time, another thought, building on what Amanda was talking about, is oftentimes we ask the community to kind of scope out the work. Think about what it's going to take you to kind of do the work. And we're happy to kind of share some of our resources with you or talk you through it. We've done this enough that we feel like you can use that 6-step process, or that 5-step process that we've identified, but you can begin thinking about where people are engaged. Some people may be engaged in each step. Some other people may be engaged in a specific step or a unique step in the process. But I think it's important to think about what the steps are. And then I see another question here is, because there are so many moving parts, you need some kind of dedicated time you need to have someone as a dedicated staff person, and that's up to the group to figure out if that's part-time, if it's full-time, if it's a consultant, whatever. But what we've learned is when these work well is there's someone who's a dedicated person who's kind of pulling all the pieces together, coordinating all the meetings, coordinating the efforts, potentially in situations is also a good facilitator. Sometimes they bring in a facilitator, but that is also really important. And going back to what Amanda was saying is the first meeting or two are going to be critical. If people feel like their time is being used wisely and they have a roadmap of what's happening, there's a greater likelihood that they'll participate. So our leadership team meetings, I don't think we got into this level of specificity, but our leadership team meetings are probably 3 to 4 meetings over the course of 6 or 8 months. And the first meeting is a meet and greet and getting people to think through a methodology. The second meeting is helping folks think about data collection. The third meeting is typically with the leadership team is having them review draft documents in terms of whether it's the assessment or the plan. And the final meeting is engaging them in coming to attend the large community meeting. So when we ask people to participate, we're really clear that it's X number of meetings for this amount of time. And the clearer we are with what their roles and responsibilities are, the greater likelihood they say yes, the greater likelihood that they want to continue with us in this process.
Absolutely. Thank you, Steve. So I think we addressed a couple of the questions that came in. There are a few more. Clarity around decision making and being transparent to the overall community. Absolutely very important. The community needs to know your process. They need to know that those meetings are open. I can't think of a process that I've been a part of where we haven't had people coming on and engaging throughout the process. So there's always people who learn, I didn't know about this process, I'd like to be involved. You want to absolutely have that information out there. And again, that's one of the reasons why we recommend using some of these tools, because if people have questions about your process, you're able to kind of track back and say, this is the methodology that we use, this is the format that we use, here are some of the tools that we use to get to where we are. So that helps also in terms of your transparency to the community. And if people have questions, you have also tying back to your leadership board that can answer questions if people have questions about the process or what's happening.
And I would say, going back to the decision making, there's clarity around decision making for the leadership team. Correct. To be clear about what the specific roles and responsibilities are of who's leading that team, what their working groups are doing, and how decisions are made. Are decisions made by vote, majority vote? Are they made by consensus? The clearer you are from the beginning, the less likelihood there's going to be conflict. And so there's something about clarity around decision making. There's also something about clarity around roles and responsibilities. And then there's also the transparency with the community. I think what happens, quite honestly, is people get so busy with this work that sometimes we forget to communicate with the broader community. So throughout the process, it's important to think about, when do you want to share information with the community? And our suggestion is you may want to share information up front in terms of telling people what you're doing. We often encourage folks to develop a one-pager and have some contact names at the bottom as to what this is. We then ask people to think about engaging folks through either interviews, focus groups, dialogue sessions, surveys, or discussion groups. And then we usually typically invite people to a community forum or dialogue about sharing the data, whether it's an assessment or a plan. So each of these pieces are great opportunities to be communicating with folks. Don't think you have to wait till the end when you actually have a full-blown report. Think about ways to consciously and intentionally communicate with folks throughout the process. And in fact, in many of our communities, when we were showing you those steps in the process before, people have communication and transparency as one of their core values or one of their guiding principles, both internally and externally.
Great. We have a question here about commitment and accountability of members, which is absolutely something that comes up in almost every process. To some extent, you have to go based on, people saying that they want to be involved and continuing their involvement. There are oftentimes situations where people would like to be engaged, and for whatever reason they kind of fall off and they are unable to continue with the process. And that is more about going back again to our hierarchy of leadership and kind of monitoring this whole process, making sure that that communication stays open, so that if someone says, you know what, I've had a change, I'm not able to commit the time and dedication to this process anymore, that they're open and honest about that, so that you're able to, if that person is serving kind of like a facilitator role or they're leading a work group, that you will be able to, you know, if possible, engage them in helping to find someone else. But if not possible, at least you're able to have a heads up and you don't lose time, because that's one of the challenges that we see happen sometimes, where someone disengages but the communication isn't there, and then you lose time throughout the process where you're, you know, trying to kind of backtrack and you're not able to make that connection, and we don't like to see you losing time as part of the process.
Could I add to that too?
Absolutely.
As you're saying, if you're talking about that, Amanda, commitment to me is also about engagement. If we're really good about thinking about how we're engaging folks, and going back to what you're saying, if we know what they want to do, and if we have a sense of why people are joining this effort, one is, you know, doing the outreach, but two is really figuring out how to engage folks in this process. And if we really are clear from them about what they want to get out of the process and how they want to be engaged, I think that also elevates commitment. I think if we're respectful of time, if we're clear about roles and responsibilities, all of those things really lead to higher levels of engagement and higher levels of commitment.
And I just want to emphasize that as well. A lot of times people feel like they want to really jump in and they want to skip over that part. And that's where you come up with some of these challenges. So when you skip over the roles and responsibilities, when you skip over, you know, asking people what they want to get out of the process and taking that and encompassing that in what you're doing, and you kind of jump right into, you know, we're going to break up into these, you know, priority area work groups, and you're going to lead this. When you skip over some of that beginning process, that's where you meet some of these challenges. So that's, in our experience, that's what we found has made this process be very successful, is taking the time to do some of that planning and work up front before jumping in with both feet.
The other thing that's there that person is asking for is about accountability. Mm-hmm. And what I think our experience has been is it's important to be clear about what you're asking folks to do in terms of roles and responsibilities and how people are being held accountable. So when you had that action planning sheet, there were a series of action steps, and then you had persons identified and their particular roles. So the clearer we are about what we're expecting, what people are committing to doing, the greater likelihood that you're going to achieve success. And it's also to say, none of these processes that we've been through have been free of any type, you know, they've all had some level of conflict mm-hmm. or some level of disagreement. That's going to be part of the human experience. So part of the work here is to allow that to happen and to figure out ways to address whether it's conflict or barriers or challenges. And a healthy process is going to have that. So not to shy away from it. And I think it's really important. Where things have worked is when there are dedicated folks doing this work, but they're holding each other accountable as well.
Absolutely. Did that and everything? Whether or not we are pulling in all relevant questions. I think that gets at, and Steve, you can chime in here as well, but I think that really gets at making sure, again, you're looking at having all of your relevant sectors engaged in this process. You're making sure that people have input. You want to ask them for their input. And that helps you to get at, are we asking the relevant questions? Have we considered what resources we have in our community? Have we considered what challenges we might have to address as a result of choosing one priority area or another? It's really about engaging people in terms of getting that information.
You're absolutely right. And our experience, let me just share with you a little story. So years ago when we were doing something around youth development, we engaged the adults in the community. And we thought we did a good job of including the community voice. And we got one perspective of youth development. What we forgot to do was engage young people. And they had a whole nother perspective. Thank goodness, halfway through the process that was discovered, and we had the room to make sure that voice was heard, because they actually had some really good suggestions about how to move forward. So as we think about this, and building on what Amanda was saying, it's really important to think about not only how to do the outreach to get people part of a leadership team, and do the outreach to engage people in interviews and focus groups and discussion groups and surveys. But it's also really important to think about how are you engaging providers in the broader community and analyzing the data, because people have different interpretations and understanding of data. And so the greater likelihood of success is really related to what levels of engagement you have in this process. And this is from young people all the way up to elders. These are all members of the community. Communities where we've worked where they've had kind of a heavy provider participation, we've had to emphasize getting community voice. Where there's been a heavy community voice, we had to emphasize getting providers. Think about your community and the demographics and what your community looks like, and make sure that your leadership team and that the data that you're gathering is really reflective of all that diversity. And that diversity could be geography, could be economics, it could be race, ethnicity, it could be culture. There are a whole host of things. And so we work with community to help them figure out how they're defining diversity. But going back to what Amanda was saying, is it's really important through this process then to figure out how to engage folks in the appropriate kinds of conversations, to think about both what the issues are and then what's the context behind them.
Great. Thank you so much for those questions. Those were very helpful, and we hope we did a good job answering your questions and concerns. Okay, we're nearing the end here, but what we wanted to do was to kind of provide you, people often say, how long does this process take? And so what we have here is an example timeline, and that being said, it's an example. We certainly have groups that we've worked with that have done this much faster, as well as groups that have taken a lot longer to do this process, but this is an example. So in months 1 through 6, in a given calendar year, you're looking at doing your community health assessment. So that's conducted to identify the health-related needs and strengths of your community. That's a data-based process that involves, as Steve mentioned, surveys, focus groups, interviews, data collection from data, qualitative and quantitative data that is existing in your community. Moving from your CHA is where you look at developing your CHIP. So that is typically another 6-month process where you're drafting your CHIP to address the public health problems that came out of the CHA, but that you've gone through that prioritization process to figure out, of all the things that came out of the CHA, what are the things that we are going to focus on in the CHIP. And then looking at the next 6 months to develop your year 1 action plan and start to then move to implement your year 1 CHIP. So this is just an example of a timeline. Again, it can be faster, it can be longer if you let it be.
And what I was going to say, Amanda, is it's so important for folks who are engaging in community health improvement to know that there are these multiple phases in the process. And so that when people, going back to something Amanda said earlier, people could be engaged throughout the process. They could come in at one phase or another. And what we really do encourage is kind of that open door. And our suggestion is, just because new folks are coming in doesn't mean you have to stop and go in the direction that they're asking you to go in. You figure out ways to engage folks, but also kind of engage folks and keep them moving forward. And so as we think about this, sometimes people think about this in a very segmented or siloed approach. These are the multiple steps moving towards kind of community health improvement.
Great. That was a lot of great information. Thank you all so much. And again, we're at this place now, and we'll give folks a chance again to ask any other general or specific questions about this process. And as a reminder, this is the quick and fast overview of this CHA-CHIP process. And there's more to come in those follow-up trainings that are coming up in the next month or so. So we'll give you a chance to ask any questions that are still lingering. But that is it from our wonderful presenters. Right, so we have a question here. Thank you so much, Alicia. If you find you have missed a segment of your population, at what point do you engage them? And, kept going, in your example, but let's say you're further along, what makes sense?
What do you think?
I would say there's never a bad time to engage engage anyone as part of this process. You could have gone through your CHA, your CHIP, and you could be looking at implementing your year one, and someone pops up that says, hey, for whatever reason, I missed all of the information that you put out there. I'd really like to be engaged in part of this process. And you say, that's great. And they might raise concerns that what their particular interest is not reflected in the CHIP. And that's where you talk about, again, this being a living document. And while we might not be working on that for this year one, that might be something that we can incorporate as we move forward with the subsequent years of the CHIP process, but having them engaged to validate them and bring them in and figure out what the best place for them to be as part of the process would absolutely, I would say, and we've had that happen throughout the different, as you've seen on the timeline, in the different areas of doing this process, and I would say there's never a bad time to engage someone.
Amanda and I are definitely on the same page there, and I think that's how we operate as an organization in terms of an inclusive model. You know, there are going to be times that people get left out. I think the biggest challenge is folks who say, well, we'll get them the next time, and then I think sometimes people feel alienated.
Yep.
And our sense is, like in that example I gave you, was we went back to young people and said, you know what, we forgot. You know, we're humans.
Right.
And so we began to think about how to engage them in the process. And I wish I could say that's the only example where we did that, but it's not. And so you begin to think about, the key will be is, how do you want to talk to them? How do you want to engage them? And how do you gather information from them? Depending upon where you're at in the process, I think you're going to have different steps. But I think acknowledging that they were missed, we found apologizing doesn't hurt either, but also saying, let's figure out how to engage you sooner rather than later. And so with what Amanda's saying, we have found the sooner that that's done, the likelihood that you won't create a schism or kind of hurt feelings.
Right. The other thing to keep in mind, too, is that we all know how cyclical our work can be. And positions change, organizations change. So throughout this process, you've seen this isn't a short-term process. Throughout this process, you're going to have new organizations. You're going to have positions that have changed in your community. So you will have new people coming in and out of this process by default. So yes, there might be someone that's missed, you know, specifically, but you are absolutely going to have new people and organizations and entities coming in and out of this process by default, just given the element of change.
Yes.
And actually, if I can add, because I've been part of the CHIP and CHOP process, I think something that helps facilitate this inclusiveness is really the process and how amazing and welcoming the facilitators are, and just the people that really encourage them to be part of the conversation. I've come in one day and facilitated something for a community who hasn't met me. I've had people join just that day after a year or two of work. And it's a lot of kindness, and yes, we love that idea, and yes, there's a parking lot for that. Thank you so much. And here are some documents that like really do like spell out what this whole group has gone through in terms of this journey. And it's definitely a lot of kind of sophistication in terms of managing those dynamics, in terms of people feeling left out or that this issue hasn't been raised. And there's definitely ways of doing it in a very delicate way that helps everyone feel really included and valued and honored. So, and I think that's something in terms of process to think about as well. Awesome. So we have another question here, and we have someone who's interested to know where the tools and charts will be listed. We will include that in the follow-up email, and we'll make it clear in terms of where you can access the recording and any additional resources, especially the ones that were shared today. We will make sure you will have that in your inbox and can easily access it. And actually, feel free to add more questions here, but we also have contact info that you're welcome to use.
And I would also say, Daisy, in terms of that question, those tools will be embedded in the slides. Feel free to access those. We encourage you to use those, amend those, edit them, use them the way that you feel that you need to for your community. If you need further assistance or help, feel free to get in touch with Amanda or myself through our email addresses up there, and we're happy to talk. nothing makes us happier than making sure these tools get out there and people are using them.
Absolutely. So again, here goes our contact info. There's many ways to get in touch. Well, one, not just with the presenters, but with the Training Institute. So we can make sure we get you the information that you need. And again, once you exit out of here, there'll be a pop-up survey, and we'd love to hear your feedback. But we can pop back to the screen before. And just to, again, reiterate, this is just the beginning of the conversation. There's going to be a part 2 that's in person. One will be offered in Boston in January. One will be offered in Central Massachusetts in February. More info to come on that. Those will be in person. They are the same content, but we're repeating it to have as many people participate and hopefully have it be accessible to you in terms of location. So this conversation will continue in that room, and we'll get a little deeper in terms of implementing a community health improvement plan. So we're definitely going to have the presenters there to help you all out, and also additional awesome resources around that. And again, I'll plug the Health Equity Series that's coming up starting in January. You have our website. Again, our contact info is on this next screen. We really would like to thank you and apologize for the technical issue earlier. We appreciate your patience. In the meantime, feel free to use any of these avenues to get in touch with us for any questions or comments. And thank you again for being with us this afternoon, and we hope you have a good one. And we hope you join us again.
Thank you, folks.
Thank you.